This presentation on the midterm review of the UN Nutrition Decade will be in two parts. I will deliver the first part on achievements, and my colleague Dr. Francesco Branca of WHO will deliver the second part on priorities for the next 5 years. As you know, the Nutrition Decade was declared in 2016 to accelerate achievements of ICN2 commitments, achieve the global nutrition and NCD targets, and contribute to achieving the Sustainable Development Goals. The objectives of the midterm reviews are to assess and evaluate achievements in the past 5 years and to revise the work program for the next 5 years. This slide shows the process for the midterm review for the Nutrition Decade. Every 2 years, we submit progress reports on the Nutrition Decade to the UN General Assembly. The progress report for 2018 to 2019 was published this year in April. We have also prepared Foresight reports on future priorities, and this will serve as a basis for consultations with our stakeholders. Before talking about achievements, I would like to talk about mechanisms for implementing the Nutrition Decade. One of the mechanisms for implementing the Nutrition Decade was for countries to make commitments. Brazil, Ecuador, and Italy have made commitments on what they are going to do to move nutrition forward in their countries. Another mechanism is the formation of action networks. These are country-led action networks. As you can see from the slide here, we have several countries that are leading action networks. For example, Fiji has one on childhood obesity, and Germany has an action network on healthy school meals. Now, I would like to go to the action areas in the work program. The work program has 6 action areas. The first one is on sustainable, resilient food systems for healthy diets. There are several things going on here, but for the sake of time, I will highlight a few. CFS is developing voluntary guidelines on food systems for nutrition. The UN General Assembly has made available to us 2 global opportunities: the International Year on Fruits and Vegetables, declared for 2021, and the International Day of Awareness on Food Loss and Waste, to be celebrated on the 29th of September every year. Under the universal coverage of essential nutrition actions, we have several UN resolutions calling for mainstreaming nutrition interventions in health systems. We also now have the UN Global Action Plan on Wasting that was published this year. At the G20 Health Ministers meeting, they have committed to accelerate efforts to address all forms of malnutrition. Under social protection and nutrition education, most countries in Asia and Pacific have increased investments in this area. Also, many countries have school health and nutrition programs. Under trade and investment for nutrition, Codex Alimentarius is developing front-of-pack labeling, which will impact nutrition policy decisions at country level. In the area of safe and supportive environment, 136 out of 194 countries have some form of legal measures on the breast milk code. There are several global gatherings where nutrition have featured highly in the past 5 years. On strengthened governance and accountability for nutrition, UN called on countries to scale up investments for nutrition. Also, several parliamentary alliances have been formed, and these have taken up the fight against malnutrition. On this slide, you can see that several UN agencies have made commitments under the nutrition decade. Basically, what they are going to do to move forward nutrition under the decade. All these commitments have been published under the Nutrition Decade website. Several civil society groups have also made commitments under the decade. Other non-state actors have also taken up the fight against malnutrition. We have, for example, the scaling up of nutrition movement that has included Food Systems for Nutrition in its work program. We cannot talk about what has happened in the past 5 years without mentioning the coronavirus. COVID-19 has presented a challenging situation. So going forward, we need to see how to protect people's nutrition in such challenging situations. On this note, I say thank you and I hand over to my colleague, Dr. Francesco Branca.
Thank you, Anna. My task is to lead you into our thinking about what can happen in the next 5 years. This is an important time, and the nutrition decades dovetails with the Sustainable Development Goal decade 2020-2030. It is also a time when there is an understanding that more important commitments could be taken, and a nutrition summit has been convened by the Japanese government, and a food summit has been convened by the Secretary General of the United Nations. And this is an absolutely critical time for food security and nutrition. As Anna was saying, the pandemic crisis has led to a major disruption and is going to probably backslide from the achievements we've had. But it's also an opportunity to change some of our practices, some of our systems to build back better. The rest of the decade is therefore a critical window of opportunity that we should consider to achieve the SDGs, leaving no one behind. We have prepared a Foresight paper that is available on the Decade website that is the basis for a series of consultation and dialogues with stakeholders. So we look forward your thoughts that can be delivered. We will have, as Anna was saying, a virtual consultation where everybody can contribute. In Action Area 1, which is meant to reshape food systems to enhance food security and nutrition, we believe that an increased recognition of the role of agriculture and food system is still needed at all levels, particularly considering the importance of local food systems and a different way to produce and distribute food to improve everybody's access to a healthy diet from sustainable food systems. An important point would be to push for crop diversification, particularly fruit, vegetables, oil crops. Another important element would be to create a healthy food environment through policies that allow access to healthy and sustainable diets. And then we shouldn't forget about the importance of food safety and ensuring that the production, distribution and consumption of food doesn't lead to foodborne disease. And again, the pandemic crisis has shown us the close link between food systems and health. In action area 2, which is about health systems, really the imperative is to make sure that effective, essential nutrition actions are part of universal coverage. We still see an inadequate coverage of some of these essential actions, very cheap, cost-effective, but still not delivered, even in situations where packages of services are delivered effectively to all people. We will focus on wasting reduction programs, again to mainstream them through health services and working on supplies, working on human resources to be able to reach a much larger group than the current 1/5 of the children in need. And this will require that health sector budgets give adequate funding to nutrition, so the funding that comes from domestic resources as opposed to the funding that comes from donor, from aid, is going to be absolutely critical. But data systems, data will need to help us monitor the situation and drive priorities for action. On social protection, again, we've learned in this month how important solid social protection systems are. What we have is inadequate. We've seen that the pandemic crisis has shown that these systems are overburdened, so they need to be reformed with clearly nutrition measures included for the provision of healthy diets to all. Schools, we need to reinvest in school foods and school nutrition education. And then in terms of our capacity, the number and quality of nutrition professionals need to be increased. There's clearly an association between the number of nutrition professionals at all levels and the improvement of nutrition. Finally, information to consumers with good system at the point of choice, particularly good nutrition labeling on food. In action area 4 on trade and investment for improved nutrition, we need to further recognize the importance of trade policies on food systems and nutrition and analyze the impact of trade agreements on these variables. Trade can be critical to ensure food security, but can also negatively affect the availability of healthy food and nutritional status. And then the investment, public and private investment, that is driving food systems, particularly public investment such as the agricultural subsidies is requiring a review to improve the impact on people's health and the environment. On safe and supportive environments, we see incredible opportunities in the improvement of food offer in public institutions, but also the regulatory approaches to shape food price and availability. We're seeing an increasing number of countries that is realizing the importance of fiscal policies, for example, on policies to restrict marketing food to children, and we're basically almost reaching a tipping point where these policies will become the ordinary. The voluntary guidelines on food system and nutrition developed by the Committee of World Food Security will be an important opportunity for this to happen. And finally, in action area 6, we need to ensure that good governance mechanisms allow to engage all sectors and stakeholders at all levels, but with adequate protection from conflict of interest. The Nutrition for Growth Summit will be an opportunity to make further commitments, but we need to have very good mechanisms to monitor the implementation of commitments from all actors. We hope in the next 5 years we can improve our collaboration, create more alliances, and create that global nutrition movement to address these new nutrition realities with more capacities, more investment to scale up implementation. We look forward working with you on this very important undertaking. Thank you.